is Richard Candia, and this is South Dade Shoutout, brought to you by the South Dade Chamber of Commerce. Every week we bring to you interesting business owners, people from the community that help make South Dade a wonderful place to live, work, play, and thrive. Today we are joined by two wonderful guests talking about a wonderful event that the South Dade Chamber is proud to host. I'm joined by Yordi Rivero. Yordi is a principal with HRB. HRB is an employee benefit and HR consulting company. She's also the president-elect of the South Dade Chamber, so she will be my boss in the future. She's not my boss right now. Dr. Charles Augustus is the chief medical officer and OBGYN with our wonderful partner, Baptist Health Homestead Hospital. And we're going to talk about the health fair.
Yes, sir.
Welcome, guys.
Thank you.
Thank you very much for being here with us. Dr. Augustus, it's a pleasure and honor to meet you.
Thank you for having me. It's an honor to be here.
Let's dive right into it. This is the almost annual, mostly annual health fair, health and wellness fair. What's different about this year's fair?
We're really excited about this year's health fair. It's a tradition that we started a few years ago. And this year it's going to be bigger and better in the sense of we're going to be at Miami-Dade College in their new building, Building C. And we're going to be all concentrated in one area, which makes it easier for the flow of the audience that's coming in, the community. We're going to have space for a lot more vendors this year. Over 50 vendors in the building itself, indoors, and we're also going to have a section outdoors where we're also going to have vendors that are more relative to the outdoors, like safety, fire rescue, the police department, activities. So we're really excited, and we're partnering for the first year, the South Dade Chamber, along with Baptist, Homestead Hospital and Miami-Dade College. So it's going to be a great event, Rich.
We're so blessed to have such wonderful partners like Miami-Dade College and Baptist Health Homestead Hospital. They almost jumped up and volunteered as quickly as you did when it came
all three of us did.
Because who wants to lead this? And in our board, Dr. Augustus, she just jumped at the opportunity. Why is it important? And this is to both of you. Why is it important for our business members to take advantage of this health fair? In other words, to become vendors at the health fair. Health and wellness.
Yeah, I'll give you my perspective, and Doctor, you can also chime in. For us, it's important to get the resources out to the community. We have a lot of businesses in South Dade that bring health and wellness resources every day, whether it's financial wellness, whether it's physical health, whether it's our local gyms, our nutrition facilities, food specialists that give us good meals, that have home deliveries. Our credit unions, banks. We have so many businesses out there that this is their opportunity to showcase, and we're bringing it at such an affordable rate to register. It's just more to be able to promote their organizations and also do different resources for the community, for our families, for the females, the males, the kids. Baptist is bringing so many resources too to be able to identify some health risk factors.
The fact that it's at such a great location, Miami-Dade College, and coming on the heels of the State of South Dade, which was such a successful event, it shows how united and how cohesive our community is. And Doctor, from your perspective, just a vendor that does have a role in promoting good health, good wellness, the community should know about them, no?
Absolutely. Our community needs to know what's available to them, and fairs like this make that apparent that these are businesses in our community. It's a symbiotic relationship, isn't it? The businesses help our community, and our community are very aware of all the things that are available to them. And
you'll have an audience just coming and going, and it's great. It's the Student Success Center.
Yes,
also
the Student
Building
Success.
C.
Correct.
But it'll be indoors and outdoors. We've had it outside most of the past few years. And so on the same kind of question, why should members of our community attend? And Dr. Augustus, we were talking about this earlier. Why should the the community? Why should they attend with their family and their kids? Why should they do that from your perspective?
Right. Well, in the fair, we'll have men's health, women's health, teen health, mental health. We will have screenings, which would be available. So the community is going to benefit from knowing all these programs that are available to them and their families. Very important, because I think a lot of people are not aware of all the different programs and that we offer, not only at Baptist Health, but our community offers. So it's very, very important.
And it's important, Rich, because what I've seen from my perspective in the employee benefits arena with employers, when we've brought health fairs to different locations on site, we have found success in folks that have never gone and gotten their preventative care visit. They haven't visited a doctor in probably 4 or 5 years. They don't know they have high blood pressure. They don't know they have, high glucose. They're borderline with a lot of issues. So bringing this health fair for us is important, because through the screenings that Baptist is going to be doing, some of these members can, for the first time learn that they have these issues and that they have resources to take care of it before it becomes a chronic disease or before they end up in a hospital. Mm-hmm. And it's the only way they may have known that, because it's a free health fair event.
It's good to know that all these resources are so available. Mm-hmm. They're so available. They're accessible. We just don't know. I would be your worst client, by the way, Jordy, because I would say, I don't know, and you'd be pushing me to all the health fairs,
that's what I'm here for, to educate you on it.
One of the aspects of health and wellness is mental health. Mm-hmm. And I know we have a few very active members of our chamber. Monarch Health comes to mind, mm-hmm. that are that dedicate themselves to mental health. Pediatric mental health is also. Talk to me about the importance of the awareness of mental health.
Mm-hmm. Doctor, would you like to?
Yes, I think that.
I'll chime in. Mm-hmm.
Yes, I'm happy to say that it's becoming more commonplace for people to report their mental well-being and talk about it to others. For so long, there's been a stigmata about being able to be open about mental health. So the fact that we will have, people available at the fair that can place people into resources which they need. We know that, depression and all types of other mental health issues are on the rise, especially, post-COVID. Mm-hmm. So we need to make sure. I always say there's two parts to everyone. There's the physical part, mm-hmm. and there's the mental part. And the mental part is just as essential to take care of as the physical part.
Right.
We've seen it from an analytics standpoint that post-COVID, the biggest increase in issues and utilization when it comes to the carriers that provide us these analytics has been mental health increase issues, whether it's inpatient or outpatient mental health circumstances. Heart disease and diabetes are on the rise. And with mental health, we've seen a lot more resources being given to members that have to do with telehealth. Mm-hmm. And being able to access a psychologist or a psychiatrist, even if you maybe can't leave your home or can't leave your work site, that you can set aside time to do it even virtually.
When you mentioned that statistic about how the incidence of heart disease and diabetes is high, we kind of understand that. But when all of a sudden mental health comes mm-hmm. in there, it makes you think that it's always been there. We just didn't talk about it.
Correct.
Right?
Mm-hmm.
And perhaps also at the fair, having an ability to speak with somebody, and then you just see other people doing the same thing, you feel like you're not alone, and there's something helpful about that as well, no?
It's become more accepted, and people are more willing to talk about it than they had before.
Right.
Mm-hmm. In our communities, where before it was, taboo, you couldn't speak about mental health. Now it's a different scenario.
Yeah, and it's not so formal. It's mm-hmm. not the chair. Mm-hmm. The guy writing behind you, taking notes, I like that. Mm-hmm. We are so fortunate in South Dade to have a partner like Baptist Health Homestead Hospital. Dr. Augustus, you have a principal role in that institution here in South Dade. we were talking earlier. I was going to ask you, what is a chief medical officer? What does that person do? I know what it sounds like. And then second, a few years ago when Homestead Hospital was built, there were some naysayers like, it'll take you years to fill in and actually reach your potential. And what has been the result, sir?
Yes. Well, first of all, my job as Chief Medical Officer is to oversee patient care and our physicians who take care of the patients and making sure that the quality stays high and that our patients get the very best of care. And I practiced there as an obstetrician, gynecologist for 30 years and transitioned into this job as Chief Medical Officer. And it's a great opportunity to take my clinical skills and adapt them to managerial skills. So it is quite rewarding for me.
You've got a statistic we were talking about earlier
that you must share.
Yes, I'm proudly to say that I've delivered over 10,000 beautiful, beautiful babies in our community over 30 years.
Oh my God, that's.
And we would like to see them all at the health fair.
Yes, I would too.
And going back to the point where Homestead Hospital is outgrown its facility, its footprint. The demand, you were telling me you're at 100% capacity?
Yes, we function at 100 to 120% capacity on a daily basis. We moved into this new facility in 2007, and so we've been there for approximately about 17 years.
Right.
And as you know, the population at Homestead has doubled in that period of time. So we pretty much have outgrown our facility, and we've learned to be able to still give excellent care under those circumstances.
So the Health and Wellness Fair, Yordy's Health and Wellness Fair, is an excellent opportunity for folks to learn about the different tools, the different services that Homestead Hospital has to offer. We talk a lot about public health, and public health begins at good habits, establishing good habits from a young age. And if you can help people learn about that early on, it makes the taxing on the services much less, and there's more of you to go around. No, you were talking about some of the new tools that we were fortunate to have in Homestead Hospital.
Yes, I'm proudly to announce we obtained a Da Vinci robot, which now we're performing minimally invasive surgery in the areas of general surgery, urology, gynecology, and we're doing orthopedics. And so what we've done is, why is that important? Well, as we know, minimally invasive surgery allows you to recover faster. It allows you to be able to have less pain and less damage to tissue. For instance, a surgery that sometimes would require you to stay in the hospital for 2 to 3 days, the patient can go home the same day. Wow. Or the next day and be back at work instead of a 6 to 8 week period of time. The recovery, like I said, is a lot faster. 2 to 3 weeks, you're back to normal function.
And you have one less bed occupied for somebody that really needs the bed.
Absolutely. And with that, we've got a complement of young, innovative physicians. Like, for instance, in general surgery, we're performing robotic surgery. We'll call bowel resections or bowel surgery, gallbladder surgery, appendectomies. And these, we've got Dr. Marlon Pastrana, we've got Dr. Rupa Sithamaya, and we've got Dan Ruiz, who are doing general surgery. And in urology, we have Dr. Juan Cedeno that is doing some wonderful urological procedures, minimally invasive, such as kidney operations, and called nephrectomies, and prostatectomies, taking care of the prosthetic parts of the men. So we have some wonderful, wonderful minimally invasive surgeons that are here to serve the community, and that's part of why we have a health fair, right? To make people aware of the new and innovative treatments that are here in our community.
So you're going to run the gamut from what you need to do to create good, healthy habits to, if you need it, you got.
Yep, it's going to be a full service, and for the community to understand, in layman's term, it's basically a health screening, being able to see your blood pressure, your glucose levels, your BMI, being able to get education around proper eating habits, how to lose weight safely, talks from the doctors about stress management and reducing stress, where to get the help. So it's not just a screening component, but coming full circle to the resources that can help address those issues.
So Rachel's been very kind in putting up your wonderful information
Flyer.
sheet, the flyer. Thank you. And over one of my shoulders has been a QR code for vendors that are interested for more information to go on there, click it, and get them and find how they can participate.
You can see on the flyer, we have there the information, the times, 10 to 2 on May 4th. Complete coincidence that it was May 4th, Star Wars related.
I don't believe it. I think that was done on purpose.
It was not on purpose, but a great coincidence. And there they can register as a vendor, as a sponsor, and for the community to know that they can attend at no cost to them, for their families. So I really encourage it. It's important. We've all come together to offer this resource as the South Dade Chamber, as Baptist Homestead Hospital and Miami-Dade College. Really, it's something that's going to be amazing and to grow further every year.
Yes.
That's the purpose of this.
In part because we have such a great partner at Miami-Dade College, and I know you've been working very closely with them. First of all, they're giving us access to that beautiful new building, Star Wars-looking building.
Yes.
There, and also they're going to also be talking about, and this does fit in with wellness. They have a lot of Miami-Dade College offers a lot of programs, not just degree-related programs, but betterment,
vocational
hobbies, wellness.
It's a full gamut of programs that Miami-Dade College has to offer in Homestead. I'm actually a graduate of Miami-Dade College, and then I went off to St. Thomas, so I'm very grateful for Miami-Dade. And I've visited the site. Angie, which is our board member as well, has been very instrumental in offering the facilities to be able to bring all these resources, and it's state-of-the-art facility.
They're very generous.
It's a great venue. The vendors are going to be, able to exhibit, in a very comfortable environment, plenty of space. And it's going to be great, and it's going to be advertised. So we're really excited. Miami-Dade College has done a wonderful job.
Yeah.
And they're putting everything together, all the logistics, and it's going to be a neat event.
And not hard to find.
Not hard to find whatsoever.
You
plenty
mentioned
of parking too.
Yeah, plenty of parking. You mentioned something interesting to me the other day when we were preparing for this. You're going to have not just what we assume, there's going to be nutrition folks and wellness folks, and of course Baptist Health Homestead Hospital is going to be there, but also financial institutions. Why is financial wellness so directly correlated to health?
Well, what I have found when I put these programs together for our employers, I look at the full cycle of wellness. So I look at the employee benefits program, how is that running, and the analytics. I look at the workers' comp and how the injuries and how's that related. And then we look at the different components of wellness. We have financial wellness, we have spiritual wellness, whatever your beliefs may be. You have then the body, the mind. So there's different components to that. And the financial wellness, in my mind, sometimes gets overlooked, but it's so instrumental because if you don't know how to set up a budget, if you're having financial constraints, nutrition is a problem. That's a lot of stress on a person, and that stress creates disease. And I know, doctor, you can speak a lot more to that, but that's what I see, and that's why it's important to have different resources on the financial end to help folks. And there's a lot of great nonprofits in our community that help.
Yeah.
Not only from a mental health standpoint, but also from a financial standpoint and getting resources and starting up your business if you're a new small business. There's so much, and many of them are going to be joining in the health
It's a
fair.
full gamut. That's great. Congratulations on thinking about that as well.
What are your thoughts, Doctor, on that?
Yeah, you said something, very true. Financial health is tied in to your mental health and your physical health. The fact that when you're stressed creates more health concerns such as high blood pressure and your diabetes, and being able to take care of your finances is all tied into those two other components of your mental state and your physical state of being able to take care of yourself. So incredible that you guys are doing that too. I really applaud that.
Thank you.
Dr. Augustus, what are your thoughts about using a health wellness fair to promote information, to push out information to the community?
I think this is probably one of the most important and instrumental ways of providing information to our community, what's available. Not only what's available, at a health fair, think about it. We talk about screening for diabetes, screening your cholesterol, taking your blood pressure, making people aware that you do have a problem and you need to follow up. And these are the resources that are here for you so you can take care of yourself and make sure. We also, there's a part that goes unsaid. We have a garden in Homestead that promotes. We normally get students that come through a hill wellness and healing garden that get a chance to rotate through and get them at the early stage of their life talking about nutrition, talk about vegetables, proper diets, proper ways to make them sure that they understand what a good diet does for their health. Yeah. And that's one of our really perks of being in Homestead and having Homestead Hospital with our wellness garden. It's just tremendous. And that will be included at the health fair. Yeah.
I had initially, one of the questions I had prepared to ask you was about kids and the importance of bringing kids to this event. I'm gonna flip that. What about the importance of bringing the more senior folks in our community?
Absolutely.
I think because many of us, and I'm part of that group, a whole life of just bad habits. So, but it's never too late. No, well, maybe it's old, but it's always, there's always a good time to start a good habit.
Absolutely, it's open for everyone, not just for the children, where we'll have kids, kids activities, kids educational sessions, but also for the general population. We've invited also local clinics that are in the area that serve our Medicare population. Medicare specialists that can come out and be a part of the event, that can educate our population. So it's open for everybody, Rich. It's for the entire community.
And we talk about nutrition, Dr. Augustus, is important for kids, but it's also as important and critical for folks of a more senior age. Mental wellness, you've got empty nest syndrome or whatever. So it's the same for everybody, no?
Absolutely. Geriatric care is very important component that gets left out. We think about the young people, we think about the children, but we forget about the elderly and what their needs are. And as you age, there's a whole different process and things that you need to be taken care of. So being at the health fair, it will help them tremendously. So it's correct from 1 to 99, so to speak. we want to reach out to everybody in this health fair.
Yeah.
Well, I can't believe we were joking earlier about do we have enough to talk about, and we're running out of time.
I like to make mention of some of the vendors that are going to be, so it gives an idea of those that perspective that would like to join. Some of our sponsors, HCA Florida Kendall Hospital, United Healthcare, HR Benefits, Mutual of Omaha, Community Health of South Florida, Chrysalis Health, Fresh Starts Behavioral Therapy, Monarch All Health, Manny Specialty Center. These are our sponsors, and also additional vendors that are participating in sponsoring, as well as Planet Fitness, Lifeway, and American Red Cross. It gives you an example of kind of
there'll be food, and there's going to be just
food trucks. It's going to be an amazing event.
So, Yordi, thank you for really steering this event. Thank you very much for doing this for us and putting it together.
I'm really happy to do it. I'm very passionate about it.
And Dr. Augustus, it is a truly a pleasure and an honor. I'm not one of your 10,000, but I'm sure we can.
And it's been an honor for me to be on the same shout out with you. It's been a pleasure, Doctor.
Oh no, it's been my pleasure and my honor to be able to be on this panel and discussion.
And thank you very much for joining us. South Dade, the place to live,